Today we will discuss osteogenesis imperfecta, often called brittle bone disease. This inherited disorder results from defects in type I collagen, the major structural protein of bone. Because the body's blueprint for collagen is faulty, bones become weak, fragile, and prone to fractures. Understanding this disease helps us appreciate how a single molecular defect can affect the entire skeletal system. The fundamental problem in osteogenesis imperfecta lies in mutations affecting type I collagen. Most cases involve the COL1A1 or COL1A2 genes. These mutations either reduce the amount of collagen produced or create abnormal collagen molecules. As a result, the structural framework of bone becomes defective, leading to decreased strength and increased fragility. This slide compares healthy bone with bone affected by osteogenesis imperfecta. In normal bone, collagen fibers form a strong and organized scaffold for mineral deposition. In OI, the collagen network is disrupted and irregular. Although mineralization still occurs, it takes place on a defective framework, producing bones that are brittle rather than strong. Radiographically, patients show generalized osteopenia and thin cortices. Long bones often appear bowed due to repeated fractures and deformities. The skull may contain multiple wormian bones, which are extra bone fragments within the cranial sutures. These findings reflect the chronic effects of weakened skeletal architecture. One of the classic clinical signs of osteogenesis imperfecta is blue sclera. This occurs because the sclera becomes abnormally thin due to defective collagen formation. The thinning allows the underlying pigmented choroidal tissue to become visible, giving the sclera its characteristic blue appearance. Other diseases imparting blue sclera are osteopetrosis, fetal rickets, Turner syndrome, Paget's disease, Marfan syndrome, Ehlers-Danlos syndrome, and sometimes in normal infants. Osteogenesis imperfecta also affects the craniofacial region. Patients may develop dentinogenesis imperfecta, where teeth appear discolored, translucent, and prone to wear. Delayed eruption, malocclusion, and craniofacial growth abnormalities may also occur. These manifestations are important because they often require long-term dental management. Although we often focus on the skeleton, osteogenesis imperfecta is a systemic connective tissue disorder. Defective type I collagen affects multiple organs. Patients may experience hearing loss, joint hypermobility, vascular fragility, muscle weakness, and ocular abnormalities. This broad impact reflects the widespread distribution of collagen throughout the body. The Sillence classification divides osteogenesis imperfecta into 4 major types based on severity and clinical presentation. Type 1 is the mildest and most common form. Type 2 is the most severe and is usually lethal in the perinatal period. Types 3 and 4 show intermediate severity with varying degrees of deformity and functional impairment. This slide highlights the 2 extremes of the disease spectrum. Type 1 patients typically survive into adulthood with relatively mild symptoms and recurrent fractures. In contrast, type 2 presents with severe skeletal abnormalities, multiple fractures before birth, and respiratory compromise, making it the most lethal form of osteogenesis imperfecta. Type 3 is characterized by progressive deformity, severe bone fragility, and significant growth impairment. Patients often experience repeated fractures throughout life. Type 4 is less severe and shows moderate bone fragility with variable deformities. Both types demonstrate how disease severity can vary even among patients with the same disorder. There is currently no cure for osteogenesis imperfecta, so treatment focuses on improving bone strength and quality of life. Bisphosphonates help increase bone density, while physiotherapy and orthopedic interventions improve mobility and reduce complications. Prognosis depends on disease type, ranging from near normal life expectancy in mild forms to severe disability or early mortality in the most severe cases.